Peritoneal mesothelioma affects the lining of the abdomen, and the treatment approach is dramatically different from that of pleural disease. Cytoreductive surgery with HIPEC, an acronym for heated intraperitoneal chemotherapy, has transformed peritoneal mesothelioma from always fatal to potentially manageable long-term. But that's only true when the surgery is performed by highly experienced specialists. Today, I want to tell you about the surgeons who are leaders in peritoneal mesothelioma treatment, where they practice, what their outcomes are, and how to access their expertise. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But finding the right peritoneal mesothelioma surgeon could mean the difference between months and years of survival. Let's start with the pioneering surgeon who transformed peritoneal mesothelioma treatment. Dr. Paul Sugarbaker, who recently retired, developed the cytoreductive surgery with HIPEC technique that's now the standard of care for peritoneal mesothelioma. His work at Washington Hospital Center and later at MedStar Washington Hospital Center established the foundation for treating peritoneal surface malignancies. While he's no longer actively practicing, many of the current leaders trained with him and continue his legacy. His published outcomes showed 5-year survival rates of 50 to 75% for carefully selected patients. Those outcomes would have been impossible before his techniques were developed. Now, before I go on with the current practitioners, I'm going to take a break here and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'll give you valuable information on where to find resources that will make a real difference for you. Now, there are several surgeons who've been recognized as leaders in the treatment of peritoneal mesothelioma. This list isn't comprehensive, but it's pretty good. Dr. Edward Levine practices at Wake Forest Baptist Medical Center in North Carolina. He has extensive experience with cytoreductive surgery and HIPEC for peritoneal mesothelioma and other peritoneal surface malignancies. Dr. Levine trained with Dr. Sugarbaker and has been performing these complex surgeries for over 20 years. Wake Forest's program has excellent outcomes, and Dr. Levine is known for his meticulous surgical technique and careful patient selection. Dr. Fabian Johnston is professor and chair of the Department of Surgery at Atrium Health Wake Forest Baptist Hospital in North Carolina, where he specializes in peritoneal surface malignancies and has dedicated much of his research into the use of highly innovative and novel strategies to improve the utilization of palliative care among patients with advanced gastrointestinal malignancies. He's published numerous papers on cytoreductive surgery with HIPEC and has made significant contributions to widely accepted treatment guidelines. Dr. Armando Sardi at Mercy Medical Center in Baltimore founded the Institute for Cancer Care at Mercy, which specializes in peritoneal surface malignancies. Dr. Sardi has performed over 1,500 cytoreductive surgeries with HIPEC and has published extensively on outcomes. His program sees high volumes of peritoneal mesothelioma patients and has strong outcome data. Dr. Sardi is well known for his willingness to operate on complex cases and for comprehensive perioperative care. Dr. Rupan Shah is a general surgeon and senior staff surgical oncologist at the Henry Ford Hospital in Detroit, Michigan. As director of the facility's peritoneal surface malignancy program, he oversees the management of all types of peritoneal surface malignancies, including peritoneal mesothelioma and other stage 4 cancers, using cytoreductive surgery combined with hyperthermic intraperitoneal chemotherapy. Dr. Rod Flynn is a board-certified surgical oncologist who specializes in treating patients with abdominal and peritoneal cancers, including malignant peritoneal mesothelioma. He practices at Mary Washington Healthcare in Fredericksburg, Virginia. Dr. Flynn also uses traditional and laparoscopic surgical procedures for intra-abdominal malignancies, and he spent 6 years as director of the gastrointestinal cancer program at Mary Washington, left to establish HIPEC programs across the country, then returned to Mary Washington Healthcare. These doctors stand out for the work they've done, but there are many others who practice at cancer centers across the country. What makes a peritoneal mesothelioma surgeon a top doctor? Volume is critical. Cytoreductive surgery with HIPEC is extremely complex, and outcomes improve dramatically with surgical experience. You want someone who performs dozens of these procedures annually, not a few. Complete cytoreduction rates matter. The best surgeons achieve complete or near complete tumor removal in the vast majority of appropriately selected patients. If a surgeon's complete cytoreduction rate is low, their patient selection might be poor, or their surgical technique might need improvement. 5-year survival rates for carefully selected patients at top centers should be 50% or higher. If a center's outcomes don't approach this, they might not have sufficient expertise, and multidisciplinary care is essential too. The best programs have oncologists, pathologists, and support staff all experienced with this disease, not just one surgeon working in isolation. What questions should you ask peritoneal mesothelioma surgeons? Start with how many cytoreductive surgeries with HIPEC they perform per year, specifically for mesothelioma. What's their complete cytoreduction rate? What are their survival outcomes? What's the median survival and 5-year survival for patients with peritoneal mesothelioma who they've treated? What's their operative mortality rate? That means what percentage of patients don't survive the surgery or immediate perioperative period. What's their complication rate? And what are the most common complications? Ask how they select patients for surgery and what PCI score cutoff they use. Based on my imaging, will I qualify for surgery? What's the hospital length and stay of recovery for timeline? Do they try NIPEC along with HIPEC? And what systemic chemotherapy role is played before and after surgery? You might want to know whether you should travel for this surgery. In most cases, yes. This surgery is so specialized and the outcomes are so dependent on the surgeon's expertise that traveling to a high-volume center is worthwhile. The surgery and recovery require a couple of weeks in the hospital and several weeks at home. But this one-time investment in traveling to an expert could mean the difference between surviving 1 year versus 5 or more years. Many patients combine cytoreductive surgery at a specialized center with systemic chemotherapy administered closer to home in coordination with the surgical team. To review, top peritoneal mesothelioma surgeons perform high volumes of cytoreductive surgery with HIPEC and achieve complete cytoreduction rates and 5-year survival rates of 50% or more for selected patients. Travel to high-volume centers where these specialists work is worthwhile for this highly complex surgery. Visit mesothelioma.net for comprehensive information about peritoneal mesothelioma specialists and treatment centers, or call 1-800-692-8608 or use the live chat feature on the website to speak to one of our patient advocates. As for me, remember to post questions below, and I'll see you next time.